So around 6.5 years back, we realized there's a big gap in terms of primary care aggregation. So the entire market was moving towards hospitalization, but there was not too much of really focus and maybe build up of the system on day-to-day care. And we realized that's a new need in the market, which is going to become bigger and bigger. So we started the company to make an ecosystem of primary care centers across the country. And now we service around 1,000 cities in India and aggregate around 2,500 primary care centers. So we aggregate various centers in the market. So we aggregate centers like SRL Wellness, could be Suburban, Apollo Clinics, Lucid. So this is across the country. This market is in a way scattered, so you don't have really national players across. So you'll have some players here and there, but not too much. So what we do is we have created an ecosystem across the country where as an individual, whatever you need in primary care health needs of yours, you can access it through quality centers close to your house. So primary care center, the primary care market actually, so this comes as a second phase to the evolution in the healthcare market. First comes is the hospitals. So first is the life and death, the most important, which is the hospitals. And then the day-to-day care starts becoming more and more important. So the Indian market, the preventive care, which is primary care, is getting bigger and bigger. But it's still at an early stage. So it constitutes of all kinds of consultation. Could be GP, pediatric, gynec, dental, opthal. Could be skin, could be mental health. Pathology, diagnostic. It's a very, very wide field. And for primary care, you don't travel too much around your house, unlike hospitals. So the distribution has to be fairly high. So in the Indian markets, it's right now in a build-out stage. So there's not enough centers or quality centers which are there, which are around you. So that's something which is becoming bigger and bigger. So that's where we are coming in. And also the second thing is the quality. So as this market builds out, the quality also will need to start getting better and better. So these are the big gaps. The third gap which we see is in terms of people's attitudes towards preventive care. So there's been a fair amount of change in people focusing on preventive care, but I think there's still a gap in terms of where it is and where it needs to go. So as I said, the first stage of any medical evolution is hospitals. The second stage comes as preventive care. However, if you're looking at what can prevent hospitals is preventive care. So that's the first port of call. So this is the time right now where the focus on primary care, will really add a lot of benefits to overall health of the population, because people will, so people start taking care of the day-to-day health. Of course, they won't need to go to hospitals as much. So that's a big gap, and I see government also focusing a lot on that. Could be simple, keeping yourself healthy. It could be even hygiene factors. And I think now more and more we see that as stress increases in the Indian society, even mental health has become very important, which government is focusing on as well. So health care is a sector which, unlike IT, cannot grow very, very fast. It has to be layered up one after the other. So first step which we saw as a gap in the market was to get a good network of primary care centers. So to build that out was the first milestone for us. Second thing, because we aggregate 2,500 primary care centers in 1,000 cities, you cannot do that without IT. So the aggregation, any kind of aggregation model, whether it's an Amazon or whether it's our business, requires a lot of use of IT. So a second milestone has been focusing on IT, which came maybe a year and a half, 2 years after we started. And the third was creating products. So if we are aggregating, so many services, a huge basket of services across so many primary care centers, there are various people having various needs going to those centers. So third is, how do we create products for individuals or even groups like corporates and insurers who want to use various kinds of services in their own fashion. So third is, how do we create products which we can market. And the fourth one, which we're focusing more and more on, is how do we build distribution. So distribution could be a B2B strategy or B2B2C strategy or B2C strategy. So this is where we are right now. We are right now in the distribution. How do we actually yes, get more and more customers into us at various channels. So healthcare, as a segment across the world is a very fractured segment. So, a dental person would be different, an opthal doctor would be different. So as a customer, it's a very, it's not a very seamless kind of access, and that's what makes healthcare further away from people. So what we are saying is that we will get health closer to you, and we use a lot of IT for that. So we'd like to integrate more and more of this ecosystem to make it very easy for customers to be healthy, and we say that we get health closer to you. So that's one of the big things which we are going to keep moving forward on. Secondly, we also would like to see how we can get these products out in various parts of the world, and we realize that what we are doing is unique in the market, and there are not many or any players in the market who are trying to use IT in such a way for primary care segments across various parts of the world. So we've been there for 6.5 years right now, and we have got funded twice, and we are right now in the third round. So we are a profit-making company, which is not easy to find in health services in this market. So I think that's where we are.